I really believe that nurses are extraordinary human beings. For you to be a nurse, it's already given that you're a good person. We care. That's why we're here.
What makes a great nurse is heart. We have a determination, and it's based off of resiliency.
You know, there's some people that run away from a fire and there's some people that run toward the fire. The nurses and healthcare professionals this whole year are those that have been running toward the fire.
Even though there was that fear, even though there was uncertainty, we found a way to connect. We found a way to help each other and support each other.
2020 has been a challenge. Not going to sugarcoat it. Just like everything, I think my motto is things happen, but better things will prevail, and we will be stronger.
This year has been tough. I think most of us started out with 2020 as being the year, right? The year of the nurse. And so when COVID hit, it sort of put a stop on everything.
It is the first time that the World Health Organization designated year 2020 to be the year of the nurse. It's very prestigious and honorable for us to be designated year of the nurse. Little did we know that year 2020 will really bring us to rise to the occasion and really serve our community.
We did not really know what to expect when COVID first emerged. We were preparing for really to have a surge of potentially hundreds of patients. We had to actually stop and figure out how to address this pandemic. True to form, I think that whenever there is a situation that we need to address, we actually do some of our best work. Everyone just rolls up their sleeves and does what they need to do. People really rose to the occasion.
I sit here 34 years into a career, but the experts are those that are at the bedside delivering care, and they have to be unleashed so that their knowledge can be really expanded upon. And let's face it, it's scary.
The pandemic gave us an opportunity to really stretch beyond what we thought were our capabilities and allowed ourselves permission to think outside the box.
What inspires me is truly how strong our colleagues are when we're together. When there was a lot of anxiety, they all came together. They made sure that each other was taken care of. They advocated for their colleagues, and they also made sure that the patients were safe. And I have to say, I am so inspired by these nurses.
Sometimes we work our best when we are stretched to our thinnest. On a lot of levels, we've just taken this in stride, and we've just kind of went, okay, this is today's challenge. Today's challenge is the visitor policy, or today's challenge is a PPE issue. And most of us just went, okay, this is what we do.
2020 has been quite a task. Being in the PPE all the time, masks all the time. It's been stressful, it's been disconcerting, but I feel like we're kind of pulling together as a team and kind of boosting each other up. That person in medicine is just a different breed of person, and they can deal with those stressful situations. But we've taken the normal stresses and we've compounded them by having to deal with a pandemic. And if we're surviving and thriving and helping each other, I think there's no way we can't come out stronger.
2020 has probably been the most taxing year for nurses at Stanford. I think that we've all really tried to band together to not only work with the COVID pandemic, but to also look at our social injustices and implicit bias and systemic racism. And I think Stanford has recognized that we're actually a microcosm of the world out there. We've discussed our ethical and moral responsibilities to deal with this crisis because we recognize that racism is a pandemic and that it's a systemic issue. And here at Stanford, we're really working towards what can we do to change the narrative. We're the most trusted profession in the world. So nursing is really in this position to help the public understand and to stand in for their patients and to advocate.
If I was reflecting back on this time later in life, I guess I would remember just how uncertain the times were and how, as a profession, how healthcare just kind of came together to support our communities and the world as a whole. And I think I'll be proud of that.
I do think that this is probably one of the most challenging years that we've ever had. We've had our resilience tested. I guess what's my takeaway? I almost feel like we can do anything after having had these experiences.
We would absolutely be stronger. We have iron feet, that we stand on.
There's a level of respect and understanding for every single role. There's empathy, there's support, there's teamwork.
We all wear these masks and these goggles and all these shields, and to kind of rise above that and to be able to make a connection with someone who maybe isn't able to have family members, you also have to be that connection to the outside world.
What I witnessed was so many amazing people, amazing human beings. What fills me with pride is that when people were scared and we did not know what was going on, nurses were still here every single day making sure patients were safe. Even if they didn't know what that meant for them. That's the heart of a nurse, I feel like. It's really about service to people, to humanity, and that really is our vision and mission here at Stanford Health Care, is really healing humanity.